Getty constipation symptoms. The condition is fairly common, however. Dr Anton Bungay, consultant gastroenterologist at the London Digestive Centre, part of the Princess Grace Hospital, has warned the gut is incredibly complex, and there is still much that is unknown about it and how it connects and interacts with the rest of our bodies. He said one of the most fascinating organs in the body, the gut, is your largest immune organ, and it contains trillions of bugs in every one of us. We need to look after it so we reduce our risk of certain cancers and keep common conditions at bay, such as constipation and irritable bowel syndrome. Dr. Bungay said there are some common misconceptions about the way it functions which can have an impact on everyday life. He has sought to set the record straight on a number of commonly believed myths. Getty constipation laxatives can be used regularly. Myth: I need to go to the toilet at least once a day. Dr. Bungay said everyone has their own normal, and no one can prescribe exactly what that is. Some people who are entirely healthy might go 3 times a day, while other people might go once every 3 days. There's a huge spectrum. What is important is consistency. If there's a significant change in your pattern, then this could be cause for concern and you should discuss it with the doctor. Is your poo normal? Bristol stool chart reveals what it could say about your health. Myth: laxatives are bad for me. Dr. Bungay said this is one of the most common questions that patients ask me when they visit my clinic. People often worry that they thought they shouldn't use them long term. However, if your gut has a tendency to be sluggish, taking a laxative won't make it any worse. If it's effective, don't be afraid to take it regularly. There's no proof that laxatives are going to make your gut any lazier than it already is, and you'll not become addicted to them, so please don't worry. Getty constipation doctor reveals how often people should use the toilet. Looking after the gut can keep constipation and irritable bowel syndrome at bay. Myth: IBS is not a diagnosis. Dr. Bungay said irritable bowel syndrome (IBS) is the most common condition a gastroenterologist diagnoses. It is a diagnosis, and there is a commonly held belief that doctors say someone has IBS when they don't know what else is going on. I'm afraid most of the time that just isn't true. IBS is a very real condition all of its own. Precisely what causes it isn't known, but we have lots of theories about why it starts and what may make it worse. IBS is unique to every individual person. Each patient will see the symptoms possibly triggered by different foods and face differing severities. If you think you could be suffering from IBS, try to take notes of what happens when you eat different foods. Sunday, December 25, 2016. 11 common digestive conditions. A dietitian can often help a patient with IBS follow a well-known diet called the FODMAP diet. This involves removing for a period certain foods such as lactose, onions and garlic from the diet. The same is also true with medication. The treatment for each individual case of IBS will also tend to be different. You should work with your gastroenterologist and GP to find what works best for you. Patients often have tried peppermint capsules for bloating, laxatives for constipation, and buscopan for cramps. Getty constipation laxatives can be used regularly if necessary. Myth: it's nothing to worry about. Dr. Bungay said many people can be reluctant to visit a gastroenterologist or GP about symptoms involving the digestive system, as they can find it embarrassing, putting problems down to something they've eaten or a tummy bug. However, it's important that you get any concerns checked out as soon as possible to avoid further problems. If you think something might be wrong, it's important to make an appointment with a doctor who can carry out tests such as an endoscopy, ultrasound, or stool tests to investigate whether something might be wrong. It's also important to start bowel cancer screening after the age of 50. 5 symptoms of bowel cancer. London Digestive Centre, which is part of HCA Healthcare UK, provides people with access to a range of high-quality digestive services.